all the delegates to take their seats for our postprandial session. Once again, I humbly request the delegates to take their seats. One announcement, those who require conveyance or travel assistance, our registration desk will be turned to a travel desk. Please intimate your requirements there as you need. Dear delegates, it's time to restart our sessions. 7-time Mr. Olympia, Arnold Schwarzenegger has said, the meaning of life is not just to simply exist, to survive, but to move ahead, to go up to conquer. His words cement the belief that we work to improve with progressive strength training. To speak about why building muscle is the key to longevity, we have an eminent faculty who has been there, done it all, and is still improving and changing. I invite onto the stage Dr. Jacob George, Professor and Head of Neurology, Government Medical College, Kottayam. Over to you, sir. Dear delegates, please quiet down and settle down so that we can move on with the sessions.
Start. Okay. Thank you all once again for coming. The topic is muscle as an organ of longevity. So I have divided this into three headings: muscle as an organ, then what is the meaning of sarcopenia and dynapenia, and how to prevent and reverse sarcopenia. Now, muscle, as we know, is essential for locomotion. At least when I was an MBBS student, there were no other functions of muscle. Muscle was required for all movement, like say locomotion, breathing, swallowing, chewing, etc. I am talking only about skeletal muscle. But now only in the recent past, it has been understood that muscle is also an organ. Muscle has very many other functions, especially it's a metabolic organ. It has two major functions which I will tell. One is that it is a metabolic organ. So muscle is an organ which mainly takes up glucose after a meal. Like just now you had a meal. Out of 100% glucose if you have taken, and of which 30 will be taken up by the liver as glycogen. 10 will be taken up by the kidney. And 20% will be taken up by the brain. That is 60%. The rest 40% of glucose that we ingest after a meal will be taken up by the muscle. By that itself, you can understand that muscle is a most important sink for glucose. And if diabetic builds muscle, obviously his blood sugar is not going to shoot up even after taking a meal. Secondly, muscle also is important for fat metabolism. Beta oxidation of fats occur mainly in the muscle. Muscle also a reservoir for amino acids. So whenever at times of starvation, amino acids from the muscle may be broken down and may be used as fuel. So muscle is a major energy producer. It produces ATP, and it also has an intrinsic creatine phosphate system by which it can make energy even when there is no oxygen supply. And muscle, by shivering, can also induce thermogenesis. And another important function of muscle is this thing called myokines. Now whenever we exercise, many organs in the body secrete many chemicals which are collectively referred to as exerkines. When it is released by muscle, it is called myokines. When it is released by heart, it is called cardiokines. When it is released by liver, it is called hepatokines. When it is released by white adipose tissue, it is called adipokines. When it is released by brown adipose tissue, it is called baptokines. And neurons secrete neurokines. I am sure in 10 or 15, if you had passed MBBS, say prior to 2015, you wouldn't have heard this term myokines even. So this is an upcoming area of exercise physiology. So there are about 600 myokines known to us now, of which we know the functions only a few of them, like IL-6, interleukin-6, or irisin. These are some of the few myokines only we know the action very well. So myokines have a profound effect on all major cardiometabolic systems. And the effect is always positive. And exerkines also has an effect on the brain, where it increases secretion, increases the production of BDNF. So these are the major two functions of muscle, in the sense that muscle is a metabolic organ and muscle secretes myokines in response to exercise, and myokines affect the physiology of the all the other organs. Now we come to another entity called sarcopenia. This again was not an entity, say 10 years ago, this was not recognized. Starting from the age of 30 years, everyone starts losing muscle, and this is called sarcopenia. So when you start losing muscle, first thing that you lose is explosive power, like say doing a box jump or doing a bench press that requires an explosive power, or doing a deadlift. That power will be lost first. Then you will have a decline in muscle mass. So this decline in muscle mass is universal and is going to occur to everyone here. So this is called sarcopenia. And along with the sarcopenia, you will also have a loss of force, which is called dynapenia. So sarcopenia is an age-related loss of skeletal muscle. Sarx means flesh, and penia means poverty. And dynapenia refers to loss of muscle strength. And this term was first coined by Dr. Rosenberg. He has explained that there is no decline with age that is more significant than the decline in skeletal muscle mass. Here we have two images, CT images of a 20-year-old athlete, the lower half, and a 64-year-old sedentary woman. You can see the whole muscles in the thighs have atrophied in the 64-year-old lady. So, what is the problem with sarcopenia? Sarcopenia affects ambulation. It produces falls. It decreases bone mineral density. The bone mineral density is decided by your muscle mass. Because only when muscle exerts force on the tendon and on the bone, then only bones remodel. So, bone mineral density correlates with muscle mass and strength. And what is the major problem with sarcopenia is that as you grow old, if your leg strength is not strong, you will fall. And if you fall, you will be admitted, and then you will have a prolonged hospital stay, and finally resulting in death. So that itself makes it clear why muscle is the organ of longevity, because muscle protects you from falling. And this thing also you have to consider, we are not telling this to patients. Suppose say 60-year-old man has an inguinal hernia and he is advised surgery. You ask a surgeon, are there any side effects? I don't think any surgeon will tell that you will lose muscle mass if you take rest. After inguinal hernia surgery, a person has to rest for has to take rest for 1 month. And this 1 month of rest produces significant sarcopenia, that it's equal to aging by 10 years. So after the age of 50 to 60, unless surgery is essential, I don't think you should, personally, on a personal note, you should not undergo surgery, because you will have a prolonged bed rest that will make you age by at least 5 to 10 years. So there is a 0.95 kg loss of lean leg muscle following just 10 days of bed rest in otherwise healthy older adults. So that's a very serious issue which people don't understand. And sarcopenia goes progressively worse with aging, but with every catabolic crisis, that with every fever or every surgery, every period of bed rest, again your muscle mass will further go down. Muscle mass and strength are actually not equivalent. Now, strength increases with strength. Suppose a person does strength training, he will not experience a muscle hypertrophy. The first thing that he will experience is a gain in strength, and only after strength increases will hypertrophy occur. And if a person loses weight voluntarily, the strength doesn't disappear. It is a loss of muscle which occurs first, then only strength disappears. And growth hormone, say if a person take it, increases lean muscle mass but not strength. With aging, strength is lost before a decline in muscle mass. Strength is actually more important than the muscle mass. So to assess sarcopenia also, it is not a DEXA scan which is ideal. It is functional testing which are still not evolved fully. This you can see the change in leg strength and muscle mass after aging. The violet colored arrow is the muscle strength. That declines grossly, then only the muscle bulk diminishes. Now, I just want to explain one concept. Just listen to me. There's a thing called motor unit in neurology. There is an anterior horn cell supplies so many muscle fibers. So we have two types of muscle fibers, type 1 and type 2. And type 2 is further divided into type 2A and type 2X. For every physical activity, we will use either type 1, type 2A or type 2X. So when we are sitting idle, say our paraspinal muscles are acting, that will mainly use type 1 muscles. When you are walking, not exerting much, even then you will be using type 1. Suppose you are jogging, then more and more of type 2 fibers come into the play. Suppose you are doing a deadlift, then type 2X will come into play. And if you increase the weight to the maximum, your 1 rep max, then the largest motor unit will get recruited. That will be the biggest of the type 2X fibers. When you age, what happens is the largest motor unit declines first. So if a person doesn't exercise, the first thing that will appear is deadlift, 1 rep max will decline. Then finally all its other aspects will decline. Finally at the age of 70, if a person has to get up from a chair, type 2 fibers are more required than type 1. So you might recall that you might have gone to many wedding functions where senior people cannot get up from the chair. But once he is assisted, then he can walk. That getting up requires a higher type 2 type of fibers for him. So with aging, what happens is the largest motor unit goes away first. Then slowly it comes down to walking, and finally getting up from a chair, everything will become difficult. So this principle is also referred to as Henman's size principle. The largest size muscle fibers are recruited for more intense activities. So for sprinting requires a higher amount of type 2X fibers when compared to jogging. So this hierarchy occurs as we age. We lose the largest motor units first, then the smaller motor units. So then the question is how to prevent, treat or reverse sarcopenia. Because this everyone has to know, because everyone is going to be affected with sarcopenia after you have crossed 30. If you have crossed 30, your muscle mass is going to decline and your strength also is going to decline. So we have to know how we can prevent this sarcopenia as well as dynapenia. So on the right side, on the other side, we have so many things like GH secretion, anabolic steroids, etc. All these are only experimental and all of them have significant side effects. These are not practical. So practically we can do only two things. One is nutritional interventions, other one is resistance training. Now if you take nutritional intervention, the only nutritional intervention what we have is high protein intake. Now how much protein should a person take? This is a controversial issue. But in a study, on a randomized control trial of some 8 different trials shows that if you increase the protein intake of an elderly person, nothing is going to happen. Sarcopenia will not be reversed. So protein intake alone will not treat or reverse sarcopenia. So protein intake has to be supplemented with resistance exercise. Resistance exercises sensitizes the muscles to protein intake. And even if you take older adults, they need higher amount of protein than younger adults, because older adults need higher amount of protein to synthesize muscle, which is called anabolic resistance. As you age, the ability of the muscle to synthesize protein declines with age. So when I compare to a younger adult, older adults require higher amount of protein. Then there's somebody was telling me, when I did resistance training, I gained a lot of weight. This is also a common this is my personal opinion. People who resistance train, does an increase in protein intake cause an increase in muscle hypertrophy? The answer is probably yes, but there's a condition. Calories should not be in surplus. Even if you take extra protein, the final calories should not be more than the calorie expenditure. If a person who eats more will obviously gain muscle, but at the cost of gaining body fat. So if you have to have the correct physique, you have to increase your protein intake, you have to do resistance training, but at the same time you have to make sure that your protein intake you don't consume too much protein that is more than the caloric requirement. That is the problem with most of the people who go to the gym nowadays. Most of them eat too much of protein. That is okay, they can eat too much of protein, but they also eat junk carbs. Finally find the daily calorie intake will be more than what is actually required, because of this junk carb, like say dosha, idli, chapati and all, finally all these people put on weight. That is because they have not trained themselves to exclude this unnecessary carbohydrates out of the equation. If you take fruits, vegetables and then protein, and then some say fermented foods, and your caloric intake is correct, then obviously you will gain muscle without gaining body fat if you do these three things correctly. Correct protein intake, then strength train, and make sure that your caloric intake is not exceeding the daily requirement. So the final thing what we have to improve or prevent or reverse sarcopenia is strength training. So here again I just want to tell a few concepts in strength training that is that is not from the scientific literature, it's from the experience of bodybuilders and my own personal experience. There are two things: muscle strength and endurance, and each aspect has to be trained separately. To get very strong, you have to use heavy weights and few reps. And to gain endurance, you can have lighter weights and more reps. For example, while doing push-ups challenge, it is only muscle endurance which you are looking at. Whereas if you are doing a deadlift 1 rep max, it is obviously the muscle strength which matters more. Of which one matters more? It's obviously the strength which matters more. And so in heavy resistance training, the first thing you have to do both, but the most important thing is to go heavy on the weights. Weights have to be progressively increased over time. Then only you build muscle, then only you build strength. And there are two types of exercises: compound exercise and isolation exercise. For example, biceps curl is an isolation exercise. A triceps overhead extension is an isolation exercise for the triceps. But we have compound muscle exercises which exercise many groups of muscles at the same time. So these are called compound muscle exercises. Now between these two, compound muscle and isolation exercise, just like I said, heavy weight versus light weight. Heavy weight is obviously always more preferable than light weight. Compound versus isolation, there is no doubt compound muscle exercises only have to be done. Even if you don't do isolation exercise, it is okay. But you cannot do isolation exercise alone and neglect the compound muscle exercise, because compound muscle exercise is the key to strength training. So we have very many compound muscle exercises. The big three are the bench press, which activates the pectorals and the triceps and the shoulders, and squats, which activates mainly the quadriceps and also the muscles of the back, and the deadlift, which activates all the muscles of the back. And we also have overhead press, then bent over rows for the latissimus mainly, all the back muscles, push-ups and pull-ups. So these exercises are essential. Anyone in any strength training program, unless these exercises are there, you are not going to build strength. And remember that when you age, what you lose is strength. That is the most important thing. More than the muscle bulk, it is the strength which is important. That's why compound exercises are always more important than isolation exercises. Farmer's carry also is a very good compound muscle exercise, which includes farmer's carry. You can do overhead carry, you can do suitcase carry, you can do carry in one hand, you can have this sandbag, bear hug carry, all these are there. Isolation exercises are less important, but you can do it to complement this multiple core exercises. And another principle you have to use is the principle of progressive overload. With every passing month, you have to increase the weight slightly, or you increase the reps slightly, and you have to keep moving up. You should not be doing the same exercise even after 1 year. If you are doing the same exercise, there is no gain out of it. And this can be your how much you have trained in the gym can be assessed by grip strength, which I have kept a grip strength counter there. If you are interested, I think many people have participated. And you also can do the dead hang to assess how good you are on strength training. And compared to aerobic exercises, strength training is now gaining more popularity, mainly because strength training improves the bone mineral density. Aerobic exercises, especially running, improves bone mineral density only in the legs, whereas strength training improves bone mineral density throughout. It improves bone mineral strength training improves the body posture, whereas aerobic exercises do not improve body posture. There are less chance of injury with the strength training when compared to, especially if it is under monitor, supervised, when compared to aerobic exercises. And it improves body composition. Improving body composition means getting rid of fat and increasing the muscle mass. That is called improving the body composition. Two people might be 60 kg, one might be only fat, other one will be muscular. So you have to improve the body composition so that you reduce your fat and increase your muscle. For that, only strength training helps. Aerobic exercises do not help that much. Thank you.
Any questions? Questions could ask.
Yes. Okay. The answer is not known, but even then, the ideal recommended daily allowance is 0.8 mg per kg. Many bodybuilders take 2 gram per kg. But there is another school of thought which you did not mention. There is a school of thought that says that only 25 gram protein is required per day for everyone. So even suppose a person strength trains and does only 1 gram per kg body weight consumption, he will this body will acquire proteins through autophagic mechanisms. All the dysfunctional proteins and the misfolded proteins will be corrected and be used by the body, which is called autophagy. So it is not essential to take 2 gram per kg. The problem with taking 2 gram per kg is invariably you are going to go into calorie surplus unless you exclude the carbohydrates. If you take only protein and fiber, you will feel full actually, and it's actually quite difficult to overeat protein. Except protein shakes. Protein shakes have a problem. There's only one problem with protein shakes. Protein shakes have a satiety value of 0. If you drink a glass of protein shake, there is no satiety with that. So invariably you will tend to overeat other things. Whereas if you take the real food as protein, say chicken breast or green gram, you will feel satiated. That is the difference between protein shake and real food. Protein shake has no satiety value. So there's a if you think your protein requirement is not met, then you can take a protein shake. But then you will have to control your hunger.
Sir, one question. Many of our delegates will be overweight or will be starting the fitness journey. So there may be their muscle mass may be minimal. There may be having fat or excessive obese. So in that state, how to attain this restricted calorie along with adequate protein intake? And one more thing is that from your morning talk, even if you are doing a fasting, how to maintain this calorie restricted diet and exercise? How we can handle that?
Question. You don't understand what
Sir, കറക്റ്റ്.
തുടക്കത്തിൽ
അതായത് ഈ കോൺഫറൻസ് കണ്ടിട്ട് ഈ കോൺഫറൻസ് കേട്ടിട്ട് മോട്ടിവേറ്റ് ആയിട്ട് ഒരാൾ നാളെ തൊട്ട് നമ്മൾ അതായത് എനിക്ക് നാളെ വെയിറ്റ് കുറയ്ക്കണം എന്ന് തോന്നിയാൽ അവർ ചെയ്യേണ്ടത്, നമുക്ക് ഡെയിലി ഈ പറയുന്ന കലോറി റെസ്ട്രിക്റ്റഡ് ഡയറ്റിലേക്ക് പോകാൻ പറ്റില്ല, അതായത് നമ്മുടെ ലൈഫ് ലോങ് പോകാൻ പറ്റില്ല. സോ ഹൗ വി ക്യാൻ attain that ideal weight?
So you start with all these 7 things. There are 7 things which I keep telling. One is eat less, avoid junk food, then practice intermittent fasting, then eat fiber, then do cardio, do strength training, sleep well. These are the 7 things. You have to improve on all these 7 things at the same time. You have to avoid snacks first. That is the first thing. Avoid sugar. That itself is a big plus point. You asked Robert Lustig was asked this question. What is the single most important fitness advice you can give to anyone? There's only one answer. Avoid sugar. Bibin stock. That is number 1. Second thing is increase daily consumption of fiber and protein. And third thing is practice at least 12 hours of intermittent fasting. That itself is a big thing. Anyone can go to 14 hours. Problem is, if you are at home, you will always feel like snacking. That is a big thing. You cannot go into the kitchen even. That room has to be locked and kept away.
Avoid home.
Then, even I have told patients, if anyone has built a house without a kitchen, lifestyle disease cannot enter that. And if you are eating only real food.
Sir, there are Swiggy, Zomato are there, so that option gone.
You can do strength training, sir. The amount of muscle mass a person has is proportional only to one thing, that is strength training. Nothing else matters. See, in the 1970s, there were very good muscular people here. There's a saying that a person who lived 5,000 years ago would look like a professional athlete of today, modern day. Even though he had very few calories, because of his strength training and mobility, he would have looked like Usain Bolt of today. That is beyond doubt. So muscle requires only one thing, that is strength training. And even though everyone will argue that protein is required, amino acid, supplementation, all these are required, body will know how to derive its protein through autophagic mechanisms.
I think that question can be reframed as creatine is for the bulk of your muscle.
As long as you take creatine, that bulk will be there. When you stop creatine, that bulk will go away.
So regarding if you are fasting and doing exercise, will body take energy from your muscle, or will the muscle mass will be stayed there?
And that is what, if you fasting, the growth hormone keeps progressively increasing. That is the main purpose of that, is to preserve muscle mass. But once fasting goes into starvation, muscle will be broken down. So you have to keep a limit there. There's a boundary between fasting and starvation. The difference is that starvation, there's breakdown of muscle. Some strength training. Pardon, sir?
Many people are diabetic. Then how a diabetic patient can take fasting?
Just fast.
No.
You have to reduce hypoglycemia. You have to keep you have to be doing under monitoring. If you are a doctor, you have to do it under your supervision. You adjust the reduce oral hypoglycemics, insulin, etc., and then keep fasting. If you are within 5 years of diabetes, you will reverse diabetes. And many endocrinologists say you cannot reverse diabetes. You cannot put diabetes into remission. You can only keep it under control. That is for the same body composition. If a person loses weight and attains normal blood sugar, then he strength trains and builds muscle, then there's no question of diabetes coming back, because muscle protects you against diabetes.
If they do not take any food, then they take, suppose they take insulin or hypoglycemic agents, they will go into hypoglycemia.
That obviously,
Surely.
obviously.
That's different scenario, sir. Insulin is entirely different scenario, taking exogenous insulin.
Sir, since you mentioned intermittent fasting, okay, so my question is that like intermittent fasting versus a calorie deficit diet, okay, so is there any extra advantage for an intermittent fasting? That's my question, because like in both scenarios it's calorie deficient at the end of the day, okay, so the person will definitely lose fat over time. So is there any extra advantage of doing intermittent fasting? Is there any evidence or supportive claims for that? Like is there any conclusive evidence proving its benefits?
Conclusive evidence proving what?
Intermittent fasting is better than your regular calorie deficit diet.
Yeah, calorie deficit is only calorie deficit. Intermittent fasting, once it gets prolonged, it goes into ketosis. All the advantages of which I mentioned in the first talk, all the advantages of beta hydroxybutyrate, all the other ketones are obtained only in fasted state, not through calorie restricted state.
Sir, and one more question. Like I give my patients such diets and help them to achieve a better life. So the main problem I face is like initially they will be having a very good motivation to lose fat and they'll stick on for a couple of months. But after that, they start, their psychological thing start to, it comes to play. So they lose interest and, as many of us, they lose interest in fitness and diet and everything. So as an expert in this field, like how would you suggest, like what recommendation, would you give to me so that like my clients and my patients can, stick to the program?
Very difficult. A person has to be motivated himself. But he can try all these 7 methods. If a person becomes expert even in one field, say only gym, if a person is very good at gym, he also obviously becomes good at diet also. Or if a person becomes a marathon runner, he obviously will learn to do strength training. Person has to be motivated to do either at least fasting. If a person regularly practices 16-8 or prolonged fast once in a year, if he develops an interest in any of these areas, he will continue to remain fit. But if he combines all this, he will be very fit.
Okay, thank you, sir.
Yes, I think the session questions will not end, so we will cut short. Thank you, Doctor. I request Dr. Bipin to hand over a memento to Dr. G.